Hi grade 11s, it's Miss Graves here. Just wanted to go over the last bit of your notes on the heart. So just making sure you're able to find it in your Edmodo. If you go to the left hand side under folders and then under blood circulation and transportation, there's actually the circulatory system notes. So we'll click on those and we'll just take a quick look through the last few slides. So you should have a screen that looks like this when you open it up. You should have most of these notes already filled in. We are just going to talk briefly about the heart. So I hope that you have already read through this. I hope you've already filled in your notes, just making sure that you have a good understanding. So the heartbeat, the heart requires no nervous stimulation to contract. It will continue to beat if all nerve connections to it are severed, but nerves do control the heart rate. So the heart itself does not beat due to nervous stimulation, but the nerves help control the rate. This is just a video of a frog leg twitching. You're welcome to take a look at it. It's kind of funny. So this is how our heart beats. So again, the brain and medulla send a signal to the cranial nerves to help set the heart rate, but we have this very important sinoatrial node, which causes the atria to contract. After the sinoatrial node, and just so you know, we'll go over these all of these things just after this. We're just going to get the pathway down first. So we have the sinoatrial node causing the atria to contract. A signal is then sent from the SA node to the AV node. The AV node signals the bundle of His, and the bundle of His signals the Purkinje fibers, which causes the ventricles to contract. So you can see that there's a bit of time that it would take from between the atria contracting to the ventricles. That's because we don't want the atria and ventricles contracting at the same time. We need that space so that blood flows from the atria to the ventricles, and then the system starts over. So again, SA node to AV node to bundle of His, Purkinje fibers. So the SA node, the sinoatrial node, what we just talked about, is the pacemaker. It makes the atria contract and initiates the AV node to send impulses for ventricular contraction. So after the SA node fires, that alerts the AV node, or the atrioventricular node, which is a mass of cardiac tissue. The AV node sends a message to the bundle of His and the Purkinje fibers, so the ventricles contract. So in case that was confusing, because it was a little bit confusing with all those new words, we'll take a look at this diagram here. So remembering our pathway, you can always look back here, use these two in conjunction. We have our SA node here, which causes the atria to contract. It also sends a signal to the AV node down here. When the AV node gets a signal from the SA node, so SA to AV, the AV node alerts the bundle of His, which is right around in this area. The bundle of His then sends a signal to these Purkinje fibers. So you can see all these fibery looking things surrounding the ventricles. These Purkinje fibers are what cause the ventricles to contract. So again, hopefully that clears this pathway up a little bit. We go SA node for atrial contraction, AV node, bundle of His, Purkinje fibers for ventricular contraction. And the rate at which these beats are happening are set by the SA node or the pacemaker. Okay, so we have a single beat, which consists of a contraction of the atria, a contraction of the ventricles, and then a period of relaxation. So if we had our heart beating constantly, if the atria and the ventricles were always just going back and forth, that would be a lot of work for the heart muscle. And it does do a lot of work, but it has this period of relaxation for all four chambers, which help to mitigate how much work the heart's actually doing. And so in science, we don't believe in just using simple terms like contraction and relaxation. So we have these fancy terms for contraction and relaxation, which are systole and diastole, or diastole. So contraction is a systole, relaxation is a diastole or diastole. I use those two interchangeably. So we have a single beat of the heart, we have an atrial contraction or atrial systole, which permits blood to flow from the atria to the ventricles. We then have atrial diastole or relaxation. So that's allowing blood to flow from the vena cava and pulmonary veins into the atria. And at the same time of the atrial diastole, the ventricular systole begins. So ventricular systole, or contraction, is when blood is forced into the pulmonary arteries and aorta. And then we have a ventricular diastole, where the ventricles relax through the atrial systole for the next beat. So if you don't look at anything else, make sure you look at this diagram. This is a perfect explanation of everything we were just talking about with systole and diastole. So we can see that the atria, the whole heartbeat takes 0.8 of a second, and the atria is in its contraction or systole for 0.1 of the whole heartbeat. So here we can see the atria contracting, forcing blood towards our ventricles, and that is a systole. As soon as the atrial systole is done, the ventricles go into their systole. Okay, so that's this diagram here. We can see the ventricles are contracting for 0.1 to 0.4 seconds. And then after the ventricles are done contracting, this is that period of time where both the atria and the ventricles are in their diastole. Okay, so atria contracts, atria has a systole, and then rests. Ventricles rest, then they contract, and then they rest again. So again, take a look at this diagram. This is a really good way to help understand it. There's a couple videos here if you want to take a look through those. Nervous and chemical factors that impact the heartbeat. So this is just talking about the heart wanting to be in kind of a homeostatic state. So if you get high blood pressure, your heart slows to reduce the output. And if you have low blood pressure, your heart rate increases to increase blood pressure. So read through that yourself just to get a better understanding. This is just kind of skimming over for you. Chemicals can impact your heart rate, so different drugs can either increase or decrease your heart rate. There's another video to look at. The next thing we'll talk about a little bit more in depth is the ECG, or the electrocardiogram. So this is this sort of thing that you see in every medical show ever. If you watch Grey's Anatomy, they're on there a lot. Anyways, a normal ECG contains 3 distinct sections: a P wave, which is when the atria are contracting, the QRS complex, which is when the ventricles are activated, and then the ST wave, which is ventricles relaxing. So here we have our P wave, again the atria contract. We then have the QRS complex, which is when you get this big spike. Because there's more electrical activity when the ventricles are contracting, you can see more electrical activity on the electrocardiogram. So again, the P wave is the atria contracting, QRS complex is the ventricles contracting, and then the ST wave right here is when the ventricles are relaxing. Okay? So if we take a look at the ECG, a normal one, this is what it would look like. You can see our P wave, our QRS complex, and then our ventricular relaxation here, the ST wave. This would be an abnormal ECG. You can see that there's not these consistent spikes of ventricular contraction. This shows the ventricles all over the place, not beating correctly. There's lots of things. This is talking about what could cause an irregular ECG. Blood pressure, just because it's a fun word to say, blood pressure is measured with a sphygmomanometer. I'm sure you've seen one of these if you've ever been to the doctor. So what it's doing is measuring your highest pressure in your artery walls. A normal blood pressure is 120/80. So a systole of a pressure of 120, diastole with a pressure of 80. Just skimming over this, read through this on your own. Blood pressure in any artery depends on the volume of blood, the heart rate, size of the arteries, elasticity of the arteries, viscosity of the blood. Hypertension is when the arterial blood pressure is constantly above normal. So you don't want to have high blood pressure. It can be caused by smoking, poor diet, stress, genetic factors, obesity. And then the last thing we'll talk about here is just briefly heart sounds. So you might have heard it described as a lub-dub. Lub is the closing of the AV valves, and the dub is the closing of the SL valves. So that's those kind of heart sounds. If you were listening with a stethoscope, you can hear your heart sounds, the lub-dub. Again, lub-dub, or the lub is the closing of the AV valve, and the dub is the closing of the SL valve. And then a heart murmur would be an abnormal heart sound, and that can indicate that there's damaged valves or there's a leak in the septum. So again, if you want to take a look at this lab, you're welcome to do so. I think that'd be a really good idea, just to practice or virtually practice using a blood pressure cuff and reading a blood pressure rate. So anyways, that was just a quick overview of everything. Again, this diagram here, really important, and make sure that you understand how signals are sent through the heart to cause your heart rate to contract. If there's any questions or any concerns, feel free to reach out to me, send me an Edmodo message, and we'll talk to you later.